Very good morning, everyone, and thank you so much for having me part of this program. And I really thank Dr. Chitranjan Mishra for giving me this opportunity to come and share some of my thoughts on clinical research and publications with all of you. All right, so let me quickly bring up my slides. All right, there you go. I usually like to start with an inspiration, and here it is that the questions you ask define who you are, and not the answers you know. It's a profound thought, and I hope you will think about it more and start asking more questions during your residency. So we are going to discuss a little bit about clinical research from concept to publications, and I hope to broaden some of your research horizons. These are some of my disclosures, and I'm the founder of Senguptas Research Academy, and that is slightly relevant to this lecture, while the others are not. So this is essentially the roadmap to publish papers. So you initially plan and execute the study. During execution, you start collecting data, then you analyze and write it up, and then you review what you have done. You submit to a particular journal, and it actually gets published in one of the peer-reviewed journals. Just to introduce myself once again, I am Dr. Sabyasachi Sengupta, and I'm predominantly a vitreoretinal surgeon practicing in Mumbai, and I am also the associate editor of the Indian Journal of Ophthalmology, and I hope I'll be able to bring some unique perspectives to this talk. The next clip has really inspired me for over a decade, so take a look and then we'll get back to the lectures.
दिलों में तुम अपनी बेताबियां लेके चल रहे हो तो जिंदा हो तुम, नजर में ख्वाबों की बिजलियां लेके चल रहे हो तो जिंदा हो तुम। हवा के झोंकों के जैसे आजाद रहना सीखो, तुम एक दरिया के जैसे लहरों में बहना सीखो। हर एक लम्हे से तुम मिलो खोले अपनी बाहें, हर एक पल एक नया समा देखे ये निगाहें। जो अपनी आंखों में हैरानियां लेके चल रहे हो तो जिंदा हो तुम, दिलों में तुम अपनी बेताबियां लेके चल रहे हो तो जिंदा हो तुम.
All right, that clipping actually again is quite profound, and I hope you'll think about clinical research in that light. Before we dive really deep into different aspects of research, let us talk a little bit about how medical practice will look like in 2030, and that is really relevant because all of you are going to be practicing by then. We are in the world of automations which have revolutionized everything. We are actually at the stage where there is AI assistance now, and you almost don't need physicians to look at a lot of images. We are going to quickly go into partial automation, and then by 2030 probably into full automation. So our roles are really going to change in terms of how we practice medicine. This is really how it might look in 2030, where the doctor is simply gloved up and not doing a lot of things in the OR either. So we need to be prepared for this, and we know that the artificial intelligence is everywhere, and it will change the interactions between doctors and patients. But most patients may not know it, and they may not know who is involved. The real question is this good or bad? It's really good for patients, because there's going to be more accuracy in everything that is done. But it's probably not so good for physicians. There are pros and cons, but as you can understand that a lot of machines are going to take away a lot of the things that we're going to do, and this is really definitely coming in. This is a must-read book by Yuval Noah Harari. It's called 21 Lessons from the 21st Century, and he coins a term called EdMed, and that is going to really change. And what he says is that how it will look in 2030 cannot even be guessed wildly, right? So that is, I think, where we are. So how can we be prepared? AI integrations in medicine cannot be stopped, right? But then it won't again happen overnight. The good news is that it is still evolving, and we can assist this evolution and be part of it rather than against it. So the real question is, we want to be part of it and not get left behind, and we want to break barriers, and we need new ways to win, isn't it? So you need to evolve as residents even from now on. And the key is think smart and work smart. Just working hard is probably not good enough. So you need to work you need to work smart. So how can you be part of this? I think you need to train yourself with data, learn analytics and some statistics, learn to present data well, and learn to write well and make an overall impression. and that's what we are trying to learn in this presentation. So overall, be good at medical research and be prepared for the tomorrow from today, right? So this is where we were, right? We plan a study, we execute it, then we analyze and write it up, and then we go ahead and publish. This is me in the year 2008. That's when I did my initial research training, and then I was not really happy. I went to CMC Vellore and did a 1 week training, and then I still wasn't happy. I went to Wilmora Institute at Johns Hopkins and did a 1 year training in clinical research. So don't get the satiety for learning should keep continuing through your career. What we are now going to look at is overall outline is why should I research, why should I publish, and how should I publish, and these are the two things which we'll see. And the first thing is why should I publish, right? So that is essentially what we are looking at now. So this is essentially a mnemonic which you can remember on why you should publish. It's called famous, and not that publications will make you famous, and actually they might, but to remember, F stands for fame and recognition, which is of course part of this. A stands for patient care, where a lot of your pivotal research may actually influence millions of lives. Make yourselves a good clinician. Overall, a lot of deliberations will help you become a better clinician. O stands for policy decisions, where impactful papers may help administrators make policy decisions. U stands for funding and grants, which are also available if you are good at doing clinical research. And S stands for the personal index. That is, a lot of citations of your papers help to grow you as a clinician. There are many different indices such as the H index, which you can actually look at. So this is why you actually would want to do clinical research. Like I said, don't take it literally, the word famous, but sort of look at it to inspire yourselves for doing research. All right, so next we are going to look at once we've seen how, once we've seen why, let's look at how to do this, right? Again, now we are looking at how we can do this, right? So the pipeline overall is that every study goes through 3 phases. Through these 4 phases: the idea, so where to get it from; the design, what is the best design for your study; what are the execution and analysis practices; and then writing the paper, right? So we'll quickly take a look at some of these. First thing is the idea. Where do you get that idea from? So this is a quick infographic to show you how to choose a good research topic, or how do you get ideas from. First is to think about subscribing to table of contents of journals. You can prime PubMed to send you updates on particular topics that you are interested in. You can have ideas from clinics. Be curious in clinics, ask questions, and sometimes if you don't find answers, there could be good research questions. Join collaborations, attend meetings, large meetings like the ARBO or the Academy or the AIOS, and try and be part of collaborations. Have journal clubs in your departments. They can actually stir you on to look at newer topics. And like I said, attend meetings and sort of set up conversations with some of your mentors or would-be mentors, and sort of brainstorm with them, and these can give you good research topic. These are some examples of how you can do this. So this is the website of JAMA Ophthalmology, and this is in the red box. You see, get the latest from JAMA Ophthalmology. You just put in your email address, and all the table of contents of JAMA Ophthalmology every month will come into your email box. And if you do this for 4 or 5 journals, you will see that about 50 or 60 research papers that are published in the month will come to your email box, and some of them are bound to interest you, and you can pursue them for your own research questions. After the idea comes the design. What is the best design for my study, right? So what you need to really do is follow the PICO approach or the PICOT approach, where the P stands for participants. That really means inclusion and exclusion criteria. Think about this hard. I stands for intervention, also means exposure for the treatment group, right? It does not always mean surgery. It could simply mean a questionnaire. Whatever you're doing to gather data, like a questionnaire or a drug therapy or a surgery or any other exposure for participants, is the I. C stands for comparison group. It could be an active or a passive comparison group, but once you need to think about this before you start your study. O stands for outcome measures. So define outcome measures well. What is the primary outcome measure? What are the secondary measures? How will you measure them and record? So is it a continuous or a categorical variable is something that you need to think about. And T is the type of study, that is whether you want to do a prospective or a retrospective study, whether any randomization and masking is essential, what is the sample size, what are your overall limitations, and are the costs reasonable. So these are some of the things you need to think about when you're designing your study. After design comes the analysis and execution, and so essentially we are talking about biostatistics. We don't really have a lot of time to get into biostatistics, but because this is itself a long lecture. But this is an ebook on basics of biostatistics. It's a very easy way to look at statistics. It's about 11 or 12 pages, and that's about it. So I'll probably share a link for this, and you can actually download this ebook and get going with some of your basics of statistics. Let me quickly show you that ebook of biostatistics and how it looks. So here's some of the tables of the table of contents. What is a variable, what are descriptive statistics, what are analytic statistics, and why do we need to know biostatistics, what is a variable, what are continuous and categorical variables, with examples. So this is a book that I think is really good for you to have. All right, so once we have looked at the analysis, now we look at writing and publishing the paper. It's always good to use checklists to write your papers. It ensures quality, objectivity, thoroughness, and critique. There's a great book by one of the famous physicians in the US, Dr. Atul Kawande, and you might want to take a look at this book, The Checklist Manifesto. So overall, a paper has an outline, which is the IMRAD format, or introduction, methods, results, and discussion, and all original articles like your thesis are all going to fall into this. This is we can't go into the nitty-gritties of each of these, but this is the website of the Equator Network, and I want you to take a look at this. And what it gives is some of these checklists for different types of study designs. So STROBE is for observational studies, CONSORT is for randomized trials, RECORD is for retrospective studies, CARE is for case reports, etc. This is again a complicated sort of flow chart, but then this is what the Equator Network will help you simplify, and it will help you arrive at what checklist you should be using for your particular study. The STROBE is strengthening the reporting of observational studies in epidemiology. RECORD is the reporting of studies conducted using observational routinely collected health data. CONSORT, there are many other applications of checklists which you can help use during your journal clubs, and so many other, while you're peer reviewing articles and other applications. This is a website called the ICMJE, or the International Committee of Medical Journal Editors, and that also gives recommendations on how you can write papers. This is one of my papers published in 2014 in the Indian Journal of Ophthalmology, and is available free for download, and has more than 6,000 hits so far. So might want to take a look at this. This is my website called Senguptas Research Academy, and there are some e-learning modules that you can look at: overview, literature review, biostatistics, manuscript writing, and rejections and references. There are about 20 overall lectures, and we have about 4,500 students from 87 countries enrolled in these lectures, so it's quite popular. And this is another slightly longer course, which is the research fellowship. You can also explore this on the website. There are a lot of interesting things like blogs on p-values, on regression analysis, on how to convert thesis to a journal article, and many other interesting blogs like getting published, interpreting odds ratios, writing abstracts properly, and sample sizes. Then we have, like I said, a lot of enrollments, and I hope some of you will take a look at some of the material that is on the website. So overall take home message is: train yourself. You can design and conduct a study well, analyze data, write the paper well, and publish, right? So this is essentially where this whole lecture was, and I hope it has made some sense to you. So think about breaking barriers and be future ready. Thank you so much for your kind attention, and I'm happy to take questions now or later if you may have them.